In the meantime, hospitals are dealing with what some are calling a staffing crisis right now.
The combination means hospitals across the Triangle are delaying previously scheduled procedures. CBS 17's Maggie Newland is digging deeper into which types of procedures are affected and how hospitals make those decisions.
As more and more COVID patients need hospital care, hundreds of healthcare workers are home with COVID.
We've had to close some beds because we don't have the staff.
UNC, Wake Med, and Duke are all postponing some surgeries.
Our non-time sensitive cases, we have pretty much asked people to take off of the schedule until after February the 1st.
Wake Med has a system to determine which procedures are most urgently needed.
We're a level 1 trauma center, heart attacks, strokes, all that. Those things go without us even considering what the bed situation is. We would do those regardless. Our cancer cases are the next in line. The things that become less time sensitive are things like knee replacements, hip replacements.
But delaying any procedure is tough.
But a lot of people have such debilitating pain that makes it hard to decide what's time sensitive.
Are these decisions you ever thought you'd have to be making before this pandemic hit?
Oh, no.
It's heartbreaking for the patient because many of them have waited quite some time to have their surgery, and we don't do it lightly.
UNC Rex is decreasing next week's surgery schedule by 30%.
We may deploy those staff elsewhere, or we may not have the staff.
The hospital says some patients may have to wait a month or more to reschedule, but most understand there's a staffing crisis.
You do need to have a nurse taking care of you after your surgery. You need a physician to be able to manage your care as well. So we're balancing everybody's needs.
And staffing and space aren't the only reason procedures are getting postponed. Hospitals tell me some patients who are scheduled for surgery end up testing positive for COVID and then have to reschedule. We're live in Raleigh. Maggie Newland, CBS 17 News.
All right, Maggie, thanks so much for that live report.
The cost of living keeps on rising.
Yeah, but good news could be coming soon. That's great to hear. What's being done that could slow inflation down.